Time now for Morning Rounds, our look at the medical news of the week, beginning with new concerns over tattoos and piercings.
A report out this week from the American Academy of Pediatrics provides guidance for doctors, young people, and families on potential health issues surrounding such body modifications. Here to break down that and more is CBS News contributor Dr. Tara Narula. Tara, give us a sense from a medical perspective, what were some of the issues that were brought up?
Well, body modification has been around since 2000 BC, and yet we've had surprisingly little guidance in the medical community about how to deal with it, although it's increasing in prevalence. We know about 20 to 30% of our youth and adolescents report some form of tattoos or piercing, and there are issues. So first and foremost is infection. So if the skin is not cleaned prior to having this done or after, you can get skin infections. And then if the ink or needles are contaminated, you're at risk for bloodborne infections, things like HIV, hepatitis C. Other issues can include inflammation or scarring, pain, bleeding, or hematoma formation, and allergic reactions. And then one thing that adolescents don't often think about is long-term ramifications. So in a recent survey, about 70% of those with tattoos and piercings report that it hurt their chances for employment.
Really?
So, yes.
Still?
Wow. Yes.
Still? Wow.
Still.
They gave some guidelines to pediatricians to address with young patients and families. What were some of those concerns?
So the most important thing, I think, first was the message that pediatricians need to deal with this in a non-critical, non-judgmental way,
right.
Okay? And they need to be aware of the regulations because they vary from state to state. Yeah. They should really talk to adolescents about researching the facility that they have this done because they want to make sure that it is reputable, that they practice sterile technique, that they keep their infection control similar to a doctor's office. So they use new disposable gloves, new sterile needles, new ink into new disposable containers. And that's very important for preventing infection. In addition, they want to make sure that the adolescents are up to date on their immunizations, that they don't take any medications that could compromise their immunity, educate them on what to look for in terms of infections afterwards and when to seek medical care. Teaching them things as simple as, oral piercings can lead to tooth chipping down the road. And then the fact that tattoos are permanent. So even though we have lasers and things that can try to remove them, they're partially effective. They are costly, couples of hundreds of dollars, and you require multiple sessions typically to treat them.
Remember, you're going to have that tattoo when you're 90 as well. Will
Yes.
it still look good? Our next topic deals with a telling survey on the overtreatment of patients. More than 2,000 physicians across multiple fields took part in this survey. 46% had at least 10 years of experience. A major finding, around 20% of overall medical care was deemed to be unnecessary. So what were some of the top reasons that they thought this overtreatment is going on?
This is such an important issue because it not only increased costs and costs our country hundreds of billions of dollars, but it can lead to patient harm. And so not surprisingly, at the top of this list was fear of malpractice. So doctors really practicing defensive medicine. One of the other issues was patient request or pressure. So many times patients feel, well, the more tests I get, the better care I must be getting. And so they push the doctor to get tests done and lab work. And then the third issue really revolved around difficulty accessing prior medical records. And that happens very often. A patient will come to your office and say, well, I had a test done recently. The doctor can't get access to the test, so they just reorder it or reorder something similar. And that can lead to overtreatment or overprescription of testing.
Did the survey address any possible solutions here?
Well, they talked about starting training for doctors early. So in medical school, really teaching about appropriateness of testing, teaching doctors to practice evidence-based medicine and guideline-based care. And in addition, really addressing this issue again of access to records and making it easier with data sharing with electronic medical records. And then one nice thing a couple years ago that came out was Consumer Reports and the American Board of Internal Medicine published online something called Choosing Wisely. And this is an excellent resource for patients. They can go on, over 70 specialties have been involved, and really look up different tests like the PSA or cancer screening tests and see, what is this test about? Do I need it? And really promote a conversation with their doctor.
All right, finally, diabetics can run the risk of hypoglycemia while exercising. In a proof of concept study, researchers at Binghamton University in New York demonstrated how a paper-based patch could help diabetics accurately measure their glucose levels immediately after physical activity. The patch's sensor is self-powered and disposable, making it ideal for working out.
This is really, really important because, one of the biggest barriers for diabetics is fear of developing hypoglycemia when it comes to exercise. But exercise is so important for the management of diabetes, prevention of cardiovascular disease. So having something like this that's simple, that doesn't require them bringing lancets and their glucometer, or more expensive, cumbersome systems would be very beneficial.
I mean, it looks just like a Band-Aid. It's that simple.
I know.
Really
How nice.
Really amazing.
The advancements of technology helping us live our daily lives.
Dr. Tara Narula, thank you very much.